Imagine someone taking out your knee and replacing it with a metal one. That seems like it would be pretty painful, right? Therapy after a major surgery, like a knee replacement, is very important to your recovery. It is very detrimental that you go to therapy after you have a major surgery because it will help you regain your strength, decrease your pain levels significantly, and help you to recover to your normal life and your daily activities. Therapy is very vital to your healing process. To begin with, therapy after a major surgery will help you regain close to or all of your strength back, and possibly you can become stronger. For example, after a knee replacement, exercising to regain strength is crucial. You will start with gentle exercises to help you bear weight on your new joint and then progress from there. According to Magnolia Physical Therapy, strengthening exercises help a person to regain balance, control, and range of motion, and all of these things are very important. Balance is very important for walking, jogging, running, and things like that. And range of motion is important for your flexibility of the surgical area. If you have a limited range of motion, then that area can't function properly and you are more likely to damage it again. During therapy, you will not only be strengthening the area that you had surgery on, but also the surrounding muscles of the surgical site. This will help to protect your joints from further damage. To regain your strength, you will do a variety of exercises like walking, leg presses, resistance exercises, and some people may do aquatic therapy as well. In aquatic therapy, you can do swimming and the underwater treadmill. All of these exercises and therapy techniques will help to build up your muscles. As you are strengthening your muscles, you are also speeding up your recovery process, and everyone likes it when we can do things a little faster. One type of therapy, which is physical therapy, and there's also occupational therapy as well, but physical therapy is designed to help you get your muscles and joints moving again after surgery through directed motions. These will help to strengthen your body and help you return to your peak physical condition. If you are truly dedicated to your time in therapy, you could even come out of your post-surgical recovery period feeling stronger than ever before. Next, therapy after a major surgery helps to decrease your pain levels significantly. For those who go to therapy after their surgery, they tend to experience less scar tissue and minimal pain as a result. Those who do not go to therapy will experience a buildup of scar tissue around the surgical site, which causes a lot of pain. According to PT Solutions, which is a physical therapy group, therapy alleviates post-surgical pain by removing pressure from muscles and joints. After surgery, it is common for that area to feel tight because the muscles around the surgical site tend to tense up. This causes even more pain. But when you go to therapy, you are given strategies to overcome these sources of pain. Therapy can also target these painful areas so you can reduce that level of pain. Many times your therapist will start by massaging that area, which will help loosen it up so your therapy will be less painful. Another technique that is used in therapy to reduce your pain is electrical stimulation. Now this sounds kind of scary at first, but it's really not. This is a short-term pain relief that is delivered by low voltage electrical currents through the skin to facilitate muscle contractions. Ultrasound machines are also used to reduce the pain. This is not the same as like a pregnant woman ultrasound. The high or low frequency sound waves from ultrasound machines can be used to penetrate the muscles, resulting in deep tissue and muscle warming. Ultrasound treatments promote tissue relaxation to stop muscle spasms and increase circulation to promote healing and reduce inflammation. Heat therapy is also used. Many times before you start your therapy, the therapist will place a heat pack on the area. This loosens up the muscles so when the therapist stretches it out, the area won't be as painful and won't be as tight. Lastly, by going to therapy after a major surgery, you can return to your normal and daily activities. After you have major surgery, like a knee replacement, you won't be able to do everything you used to right away, and this can be disappointing for a lot of people. At first, you will have to use crutches or a walker to help you walk. You won't be able to drive, and it will be hard for you to do normal things. But with therapy, as you regain your strength, your flexibility, and range of motion, you will soon be able to do all the things you once could. According to Bella Vista Health Center, therapy can also restore self-confidence, allowing you to accomplish goals you may not think possible otherwise. When I did an internship at a rehabilitation center, I would see many patients come in after their surgery and they would talk about how they are afraid to go into public because they are afraid they might fall or someone might accidentally bump into them and hurt their surgical site. Once they have gone through therapy and they have regained their strength, their flexibility, and their range of motion, and their pain level has decreased, They aren't as afraid to go out in public and do things because they now have more confidence in themselves. They know that they are stronger, and so they will be able to catch themselves if they fall or if somebody accidentally bumps into them, it won't hurt as much. So today, I've talked about the 3 main benefits of therapy after a major surgery. You are able to regain your strength, your level of pain decreases significantly. It can decrease from like a 9 to a 2 even. Then after therapy, you will be able to return to your normal activities. So I want to leave you with this. Imagine you just had a major, painful surgery. Don't you think it would be important for you to go to therapy so you will be able to recover in the best way possible?